And welcome back. Well, we know everyone sees the world a little bit differently, and this applies in figurative and literal senses. But our next guest takes the literal approach because they can correct your vision to suit your own unique lifestyle. Joining us now is Dr. Nicholas Bruns. He is the lead optometrist at Summit Eye Care of Wisconsin, and we're excited to have you back, Doctor. Good to see you.
Thanks for having me.
Yeah, so this is great. I love when you're here because I feel like I learn so much every time.
Yeah, this is great.
My aunt just had cataract surgery literally 2 days ago. She's having her next one on Monday.
Everything
this is
going
something.
well?
It went well.
Good.
And she was also having a lot of floaters. And I think so many people out there, they wait too long. My mom waited really long. She did not.
Yeah.
But a lot of people don't understand what cataracts are or when they're starting to get them. So what are they?
Yeah, cataracts, we all have a lens in the back of our eye. It's kind of the window to the retina, right? And cataracts are inevitable. Everybody will get them if you live long enough. And basically what happens is that lens starts to cloud up. And so we kind of think, you know, is it time for me? Is it time for me? I'm a huge advocate for getting the cataract surgery done sooner than later.
Yes.
The longer you wait, the harder it sometimes can become. And you're just costing yourself years of great, awesome, customized vision.
Well, I think what they both talked about, my mom and my aunt, they're both in Minnesota, is about getting diagnosed, you know, because I feel like some of it, you know, they also had to really talk to their doctor about it. How are you diagnosed with cataracts?
It comes down to complaints, and everybody is different. We all use our eyes in very different ways. So glare, halos, you know, changes in your activities of daily life is usually how we start to have that conversation. Now, like I said, anybody over the age of 60 is going to have some element of cataract. The question is it visually significant or not? And that comes down to daily activities. And that's when you have to have that open conversation with your doctor.
I like the fact that you mentioned things like the halos and things like that, because I feel like lately with the rain, you know, at night, people can tell when their vision is off because it's really hard to see anyway in the dark with rain. But if you've got some cloudiness or issues or cataracts, you're really experiencing it with the lights.
Yeah, and in Wisconsin, it's dark 20 hours a day, right? And we have the snow. So yeah, we get these complaints, especially right now after daylight savings time. We get people coming in all the time talking about that.
Yeah, absolutely. Okay, so how are cataracts traditionally treated then?
So it's a simple surgery. It's a procedure. It takes about 8 to 10 minutes. We take the lens out and we put a new lens back in. So traditional surgery, we're just getting rid of the cataract. Now, a lot of people come in thinking that that's going to get them out of glasses too. Well, with traditional surgery, you probably still have a small prescription and you still need reading glasses. And so that's the difference between traditional surgery and customized surgery, which is something that we offer.
So it doesn't need to be this one-size-fits-all surgery.
No.
You're saying what we're seeing can be real customized.
Absolutely. This is not your grandmother's cataract surgery anymore. We do things very differently. We customize a treatment plan patient to patient. It's very different. Like I said, we all use our eyes differently. Vision is subjective. We quantify it as much as we can, but it's subjective. And so let's say you want to be able to see at a distance and drive, if you're an airplane pilot, for instance, or if you do a lot of knitting and a lot of high near demand, we can customize your outcome to get you out of glasses or at least reduce your dependency on glasses as much as possible depending on your lifestyle.
Can you do, because I think I saw one of the things on there with an astigmatism.
Yeah.
Can you do an astigmatism?
Yeah, that big fancy word, that's what people always get worried about.
I never really understood quite what it was.
It just is a little bit of an irregular shape to your cornea. Think of your cornea like a football versus a basketball, but that does not take you away from candidacy out of premium custom cataract surgery. We can definitely do astigmatism.
Okay. So who is the best candidate, or who's a good candidate to do this customized cataract surgery?
It's just a lifestyle choice. You know, how do you want to use your eyes? Do glasses bother you? Let's say that you had contact lenses and you're just kind of grown intolerant to them. They cause you irritation, dryness. You know, if you want to get out of that, that's where we can customize things. Again, we're trying to reduce your dependency, and it's just to match your lifestyle. So everybody's a candidate for it. It's just, do you want to wear glasses or not?
And isn't it true, because I feel like you've talked about this on the show before with Dr. Menomonee as well, because she had it done by you, talking about how you can tweak it.
Definitely. So
that's like afterward, like if it's not exactly where you want, you can just quick tweak it?
That's one of the options. So there are different options. There's different ways to do this, but that's one of the options where we can actually change the power of the lens after the surgery is done. So that conversation of how do you want to see becomes less theoretical. You know, we actually do the surgery, test drive your vision, and then we can adjust it to match what you want.
Is that specific to what you do? Because I feel like with my mom's, there was no tweaking. You know, I feel like whatever she got done was done, you know?
That's the traditional method. I mean, that's what a lot of people do.
Traditional, it was just one and done.
Pretty much. We use all of our measurements, everything we do before surgery, and we have to sort of outline a plan moving forward. But this way you get to see how it turns out and then change it based on where you end up.
Okay.
Yeah.